Hello, this is a public service announcement on the Latino Health Access Organization. So, an introduction to this organization, the health behaviors that are targeted are exercise and eating unhealthy foods, among others. The population in the community are underserved Hispanic families or Latino families that include children and the parents of the children. The health issues include obesity, diabetes, and breast cancer, and they have many other ones as well. The two Healthy People 2020 objectives that are related to this program are increase the proportion of adults who are at a healthy weight and also prevent inappropriate weight gain among children and adolescents ages 2 to 19. Just a brief overview of this organization. It's a nonprofit community-based organization. They get funding through fundraising events, donations, and sponsors, some of which include Sisters of St. Joseph Orange, HOAG, and Viva la Salud by Northgate Market. Their mission is to partner with communities to bring health, equity, and sustainable change to education, services, conscious race, and civic participation. Their mission is further divided into two areas of focus. The first one is to deliver culturally appropriate health-related services and programming to address urgent health concerns, and the second one is to engage individuals in low-income, low-opportunity areas in transforming their environments and creating positive, concrete changes in their homes and communities by providing tools, training, and mechanisms for civic engagement and participation. As for the history of the organization, it was founded in 1993 in Santa Ana, California, by a public health doctor known as Dr. America Bracho. The organization was made in order to combat health issues and basically just help accommodate and satisfy the unmet needs from the people of the community. The volunteers, staff, and interns, they're really an essential part of implementing and carrying out the programs. Volunteers are welcome and encouraged if you're over 18, have a higher education degree, and are part of the community. They're extremely essential because the way that the interns, employees, and volunteers are recruited is unique and has its advantages. It is through a method known as the promotora model, or otherwise known as the promoter model. It is used to help seek out people who are actually a part of the community where the program is taking place. The community members who are recruited and get involved in the implementation of the programs are people that live in the neighborhoods, like children, elderly, and even parents. Doing this creates a sense of trust and comfort for the participants involved. As for the marketing, it relies heavily through the use of the promotora model in order to recruit people who actually know the people who are staffs at the program. Some of the strengths are the cultural competency, because their use of language is actually really relevant. They use preferred languages such as Spanish to the Latino participants involved, and also through the promotora model because they actually have people who are representative of the community within the organization. The weaknesses is they do not answer emails and do not have enough information for their educational programs on the actual webpage. As for the current health education program, it is known as the Healthy Weight, or Peso Saludable in Spanish. The goal is to prevent, deter, and combat obesity before the disease manifests itself. The objective is to assist children and their families in achieving a normal, healthy weight through education, intervention, and nutrition and exercise. The program itself has basically a duration of 1 year. It includes a total of 8 weeks for the actual intervention, and then the remaining year is for the maintenance of the behaviors. So it operates with the help of the promotores who plan and carry out in-home visits to make their intervention more personalized. Not only do they do in-home visits, they do visits to the people's houses, like apartments, garages. They even do laundromats, and this is to make it more accessible for the participants to actually get the education intervention. And there is no data available on the webpage on the effectiveness of the program. So the behaviors, skills, and attitudes that are needed to be culturally competent in this program are validation of participants' perspectives and beliefs that may include religion and other things. Try to communicate Spanish if needed. They already do that. Personalized implementation of intervention education, do that as well. And provide resources and support that meet the unmet needs of the participants. The skills include effective communication, leadership, empathy, and creative thinking. The attitudes include respect, sensitivity, acceptance, open mind, and humility. The CBO has reached cultural competence with the use of language, the use of color design on the publication's website, and through the use of having board members, volunteers, employees being representative of the community. The leadership key contacts, so the main ones is the program coordinator. Her name is Francisca Liao, and this is her email. It's fliao@latinohealthaccess.org, and there is the main number, and her extension is 1022. And the next two key contacts are really important in the coordination of the program as well. And To the right is just the address and the overall email, the main email. And these are the references. Okay, thank you.